the amount of stress everybody's under. You can see it in my hands. It's like it's crescent. Thank you. She notices from all the way over there. And it probably is responsible for some of the calcification. No?
I doubt it.
Just the bicuspid thing is the thing?
Yes, you were born with a bicuspid aortic valve, right? And the bicuspid aortic valve, it's the commonest cardiac anomaly, congenital anomaly. Okay, so 1% of the population is born with bicuspid. And what happens in bicuspids, there are actually two flaps. A normal, aortic valve has 3 flaps.
Right.
All right? And in your case, there are 2 flaps. And the valves that actually have 2 flaps or bicuspids, they're more prone to wear and tear. Okay, so therefore they get calcified, they can become narrow, they can become leaky.
Right.
All right?
Mine's doing all that.
So that's correct. So you've developed what is severe aortic stenosis.
But isn't the bicuspid valve sexier?
You're funny.
But we're gonna just go in and pop it in and pop it out tomorrow.
Okay, well.
And I was looking at your heart.
I wouldn't call it pop it in and pop it out. All right. So
it's this thing right here, right?
So this is a different valve, though.
Okay, that's a different valve.
That's a different valve.
Yeah.
So
Okay, so all that information I give you is totally wrong. Which one is it then?
no, that's the aortic valve.
Oh,
that's
it is?
true.
Okay.
No. So this is a different type of a valve. This valve that we have here is called a lotus valve. We're going to use a valve called the sapien valve.
Okay.
In you. Okay, so it's a valve that expands with balloon. Okay. And essentially, what we are going to do is we're going to go from your groin. This will be under anesthesia. We want to have proper imaging when we are doing this procedure. So we'll also have what is called a TEE probe. All right. So there will be an echo probe, an ultrasound probe that will be in your esophagus, which will be behind your heart. So we get beautiful images. All right. And then we will go ahead and create a little bit of room first, okay, so that we can advance. So we will cross the valve, use a small balloon, stretch it a little bit, and then we will advance your new heart valve, okay? And that old heart valve goes into your own heart valve, inside of that which is narrow, and we blow the balloon, it pushes the old valve out, okay? Your tissue valve will be pushed out, and then inside of that is the new valve that will stick in there like a stent, and inside the stent are the leaflets. All right. So, and this valve has 3 leaflets.
Okay, not the sexy one. I'm downgrading. Okay, so and what they told me also is that I'm going to feel a lot better because it's like a hose that's got a crank in it, so everything will go like.
Yeah. So if you were to make a comparison, in your case, a normal valve would be like a size of a quarter. Okay. Your valve has become the size of the back of a pencil eraser. You know what I'm saying?
Okay.
So I think so it has become quite narrow, and that's the reason to go ahead and intervene. And as you and I talked earlier, there are a couple of choices you have.
Right.
You can either go for open heart surgery, okay, or you can go ahead and have this transcatheter aortic valve procedure.
Right.
All right.
Which I think is better.
I think there are.
This is what it looks like.
This is what it looks like.
Yeah.
Okay, so it almost looks the same, but not. Okay, what kind are we putting in? Human, cow, pig.
Okay, so the valve has a frame, which is of course made up of nitinol, and then the leaflets in there are made up of cow's pericardium.
Okay, it's cows.
Yeah.
Okay.
And then you were asking me what are the pros and cons. I don't know if you went through these earlier. So surgery, of course, is a lot more invasive.
Right.
Okay, but it's a procedure that has been around for a very long time. Yeah. Transcatheter heart valves, we started doing them, the first one was done more than 15 years ago.
Okay.
Okay. I've been doing this now for almost 11, 12 years. Yeah. And we do a lot of these procedures.
How many do you think you've done?
More than almost 3,000.
Or
Or 3,500.
Yeah.
Actually. All right. This is
cool.
This is what I do. Okay. This is I'm very much involved in developing this procedure, doing research. research and sort of often doing it in patients who are
They told
a
me
difficult subset.
that you're broadcasting to India,
That's correct. So tomorrow.
teaching them how to do it.
Yes.
That's great.
Okay.
Yeah.
Yeah. So as we were.
I'm starring in that.
Yeah. So we we've done some analysis on bicuspid patients, and we can get good outcomes. Okay. It all depends upon the anatomy and how calcified. Your valve has calcium, but it is not super calcified.
Okay.
Okay. So I think it should be helpful in terms of getting a good result.
And what happens if this one gets calcified?
Well, then we can.
She's a small annulus, so it's a 20.
Yeah.
It's a what?
We're talking about your size because you're small, your valve size.
Oh, okay.
Yeah. So I
And
think
you were going to put in something slightly bigger than what I have.
that's correct.
Right.
Yeah. So we always have to oversize a little bit.
Okay.
Okay. So that's how the valve sticks.
So if it failed
If it failed for whatever reason, then you may have to go for open heart surgery.
Okay, but then that's
Okay.
later. Yeah.
Yeah.
All right.
All right.
Yeah.
I mean, see, with the autoimmune disease you have, the CREST syndrome, with the
We're going to get rid of that.
because and the fact that you have a small annulus, okay, it does make you not the best candidate for open heart surgery
Right.
either.
I
You
know.
know what I'm saying?
I know.
So we've
It'd
got
be
to-
really difficult for me to recover from something like that.
Okay, so
I
I
think.
think what we have to do is we have to work with what we have.
Yes.
All right.
I've been doing that for a long time.
And we have.
I'm very comfortable with you. I'm very happy that I was able to jump through hoops and, get my insurance to switch over in the middle of the year like that. I'm so looking forward to this.
Okay.
So,
Terrific.
thank you.
All right.
All right.
Okay, so I'll get her angiogram
Yeah.
and we'll go from there.
Yes.
Okay. All right, so I
can
need
have-
you. I
can
can
have
have
my
these
heart.
back, yes.
Here.
What I
Here's
need
this
you
one.
to do, you had your angiogram at Kaiser, right?
Yes.
They never send me the images. So
They never
where-
sent it to you?
No, not the angiogram images. So I need somebody to go there and get it for you. So
I can.
Okay, and then they already have a bed for you here, so this is good.
Okay.
So basically, go to Kaiser wherever you have your angiogram. Go to medical records, and ask them to give you a CD,
Mhm.
like you're having surgery tomorrow, and you need it now. 'Cause
Right.
It was not sent for whatever reason.
Okay. The angiogram.
It's the invasive one where they go from here or to the groin to look at the coronary
Okay, I
arteries.
know what it is. Yeah.
Yeah, you
Okay.
had that because
I-
I have report. I just don't
I
have the
do
pictures.
have that, and I do remember them doing
Yeah.
it. They did the
To the
whole
groin,
thing,
yeah.
right? So I need that,
Mm-hmm.
and I do have that on my computer at home. Now, do you want me to actually check in today?
Yes, we're gonna admit
Oh
you.
my God, we're gonna admit me. That's really good.
Yeah, they already have a bed for you,
Okay.
so that's good.
Yeah, because I don't want to sleep on a floor.
I hear you.
No, and I don't want to be late tomorrow. 'Cause
Yeah, I don't
we
want you to
hit
be late.
huge traffic.
Yeah, traffic is insane. It's
It was.
that's why we admit you.
So you're on
Make
time.
sure we're on time.
Okay, so this is really good. Let me
Okay.
go get that information.
Get
for
that,
you.
and let me kind of cover. I don't know. I stepped out. I don't know what Dr. Makkar told
Okay.
you, but let's talk about the risks.
Okay.
Your valve is critical. It has to be done. Without
Yeah.
it, you cannot live, right? Eventually, it'll catch up with you. But anytime we do anything to your heart, there's a small risk of death, 1%, small risk of stroke, about
Right.
1% also. The small risk of needing emergency open heart surgery, also less than 1%. But if you don't treat you, your survival is,
Right.
right? You know that. So other complications are needing a permanent pacemaker. About 10% of patients end up with a pacemaker. If you need it to save your life, you will get it.
Okay.
Okay. Other complications are bleeding and vascular complication, bleeding around the heart, bleeding in the groin. If it is bleeding around the heart, sometimes it's emergency open heart surgery. Sometimes it's just a small little needle in the under
Right,
the
to
breastbone
drain
and then
it.
drain it,
Okay.
and then it heals. We give a reverse because we give you blood thinners during the procedure, and then we reverse it and it heals. Okay. Groins can bleed. You're a pretty petite lady. The valve you're going to use is pretty small, but all of it, your CT looks good. That shouldn't have any problems, but
Okay.
we are putting big catheters in your groin, so your groins will be really sore.
Okay.
I want you to expect that. It's normal.
Kind of like sex for the first time.
Yeah. way. But it
Might
takes
hurt
care
a
of
little
problems,
bit.
yes. So little soreness on both sides, sore in the throat because there was
Yeah.
a bleeding tube.
Yeah.
And there's a camera to guide us as we put the valve in to make sure there's no bleeding around the heart. Okay, and they always use a brain protection device on everybody that gets this procedure now. So they'll put a little mesh right above the carotid arteries to protect your brain. So you'll have,
so you don't get a stroke.
right.
That's a
We'll
good
try to
idea.
prevent it. Yes.
Okay,
yes,
good,
Okay. So you have like smallpox, right? Radio and both groins. One is to put the valve in, one is to take pictures.
Right.
So all of these will be a little sore.
Okay.
Okay.
So cameras go up this way, and then
That way, and
the
the
catheter
camera
goes-
through the esophagus and the brain protection. So a lot
Lots
going
of
on.
cameras.
Yes, lots of cameras. Yes, and the X-rays.
Okay.
Okay. So usually in a hospital one night, if
Okay.
everything goes according to the plan, you're
So-
discharged the following day by noon.
Okay.
If everything's fine. If you had an arrhythmia or bleeding, then you stay a couple of days.
Okay. But chances are I'll be home by Saturday.
Yeah,
Or Sunday.
Saturday afternoon.
Yeah. Okay. That's
the
pretty
usual.
good. Okay.
That's the usual unless there's complications and a little bit longer.
Okay.
Okay.
All right.
All right.
And you're getting me the footage of all this.
From India Live,
Yeah.
I'm gonna try my best. Okay?
Please
All right.
do it.
Okay,
Oh
I'm
my
gonna try my
God.
best, or I'll send you a link because they usually put it on internet.
Okay,
So I'll
and then
find a link.
we could
And then
probably
you
have a
can
camera guy
cameras
just do
record
it there.
Yeah.
Okay, that would work
Because
too.
when they're there, I'll ask them to give
I
me a
want
link.
people to know about this procedure because you do not know how they try to get me to do open heart,
yeah,
and I'm
because
going like,
So recently
gut
that was
reaction.
a gold standard, right?
yeah, I know,
Yeah.
but people have to know
Yeah.
that the Mick Jagger is available.
Yeah, yeah. You're funny.
That's what I call it
yeah,
now.
Yeah, exactly. He had it, right?
I can do the dance.
Yes. You're
Used to do
funny.
it in
Yeah.
Yeah, I'm excited. I did not know I was going into the hospital tonight, but
Yeah.
that's
I
really
think
good.
that's best because we don't want to delay some, for
Right.
you, and we requested this a while ago. Anyway, so they already have it. So if you just go get me the disc, bring it to me, or he can bring it to me, and
Okay.
then you go to the South Tower to register. They're waiting for you.
Let's do it.
Okay.
All
So
right.
fasting after midnight, they will know what to do because you're in the hospital. They won't feed you.
They won't feed me.
Your procedure. They'll take you to your procedure around 6:30.
Okay.
Okay.
Thank you so much.
Oh, my
no,
pleasure,
no,
my
I'm so
pleasure.
happy. I'm so
Okay.
happy.
All right. You call me if you need anything, but I really need that CD.
Okay.
It's most
Well, that's what
important.
we're going to go there
Where
first.
did you go to?
Then I'm going over to see Sally,
Yeah.
and then I'm going to go over
The
here.
South Tower
Yeah.
registration. Yeah.
Okay.
Okay.
I'm done.
All right.